Okay, my friend, thank you for coming for varicocele surgery to our clinic. Thank you for choosing us. It's an honor for us to have people from other countries coming for this surgery. We have a special technique, as you know. We improved this technique because I recognize normal varicocele procedure is recurring. It's not enough. So I changed some things in this normal conventional surgery. It has it has 70% real, cool 70% success rate, but 30% it is recurring. Also, embolization and other techniques, all techniques are recurring. So in my technique, my recurrence rate is still 3%. There are some guys which we take huge veins. They are very prone to get another vein. Their body is producing this vein continuously because testis is fed by arteries. Arteries taking blood, and this blood must go back. And when it's going back, it is pushing the veins to dilate, and it may make this recurrence although we take every care. So now your operation is very successful. We make the control with Doppler ultrasonography. There is no residual vein. Even in standing up position, laying down position, everything is looking great. And I want to ask you, from the beginning, how did you understand you had this disease? Then how you decide to come here? Why you choose this our clinic and such things?
So I was in Bulgaria when they found that I had varicocele. It was maybe last summer.
Last summer, yeah.
Yeah, last summer. And then, since I didn't have any pains and any complaints about it, the doctor said there is no problem with it. I can postpone it for a later period. At some point.
Sometimes they say, "Come when you marry." It's really nonsense. You will never know when he will marry when. So if sperm count is decreasing, operation is urgent. What was your situation?
Yeah, the doctor said there will be the surgery will be needed, but not urgent. So I can postpone it for later. And then I went back to the UK where I'm working, and the pain started.
Pain started.
Yeah.
Are you exercising such things?
Yes.
Okay.
Yeah. I started going to gym every day. Then the pain started.
Yeah, that's why it's.
That's why I started to search a solution in the UK, but the system there, the healthcare system, is really slow, and they are not considering the varicocele was a serious problem.
It can wait. It can wait.
So I had to wait. I'm still waiting for scanning.
Scanning?
Yeah, for scanning. I'm still waiting. That's 3 months now.
And then they will you will wait for the doctor to see it. Then doctor will schedule the procedure.
Yes.
People asking me, what's your waiting list, waiting list, waiting period? I say 15 days. They say, what? Really? It's cool. I said, no problem. Even if it is an urgency, I can operate tonight. I can operate next days in the weekend. We are flexible.
Yeah, but that's not the case in the UK.
So
then I decided to do research on the internet, and I found you on YouTube. And then I watched all your videos on YouTube. And I just decided
you
to
agree
come.
that this is a different and
I found that your technique is different, and the chance.
We made an online consultation with you.
Yes.
So people, when they see me in YouTube, of course we have some connection, WhatsApp numbers to communicate.
It's really easy.
Yeah, actually, it is. Look, if I look to my phone now, there will be 10 messages every moment, and asking like this: "Hey doctor, this is my sperm count. Do I need operation?" So this is not possible for me to make a diagnosis from distance, and it is not ethical. It is dangerous. I never do it. If some doctor says you need an operation, it's clear that this guy has need an operation, and if he chooses me, then this internet communications are just to ask what is the cost, how can I come, how can we arrange. So we scheduled, and I recommend patients to have a for having a detailed conversation to have an online consultation.
Yeah.
And I asked some money, like $50 for it.
Yeah.
And
No, it's normal.
yeah, you choose it and we
Yeah.
communicated. Do you think it is needed and it is good? What's your
It's
comment?
good. It's good to have it because I can share my experience and my previous consultation with the urologist in Bulgaria. So
And people send their results.
and you know my story, you know my case better than
Yeah.
just send you a
And
message.
we discuss with you at this moment, face to face. I look to your results and
Yeah.
ask you questions.
Yes.
You give me answers. Otherwise, when I look to my phone, oh, there are many messages. I try to, in between the operations or in between a patient, I try to write, yes, you need operation. Yes, you don't need operation.
Yeah.
You, please do that, please. And 10 days after, the patient sends me another test. Hey doctor, compare. What's that? What was his results? Go back, find the other results. Impossible.
Yes.
Now it's morning time, we are working, we have patients, then I have operations,
Yeah.
then at night I have to rest. So I go home, so it's impossible. So
Yes.
people, please don't expect me to make a diagnosis.
Yeah.
I will only help you if you decide to have this procedure with us, with this technique. I will help you to arrange things. Of course, we can. I can answer short questions, not in that moment, and I will not remember your old results
Yeah.
10 days later
I know.
or 1 day later. So, but I recommend everyone to make an online consultation,
Yes.
and yeah, it is not too much costly, and it is really beneficial and successful.
Yeah, definitely.
Yeah.
Yeah. I agree.
So then we made an online consultation. Then we agreed that you will proceed with this procedure.
Yes.
Then what did you do? You booked the flights, such things? How did you?
Yeah, both flights from the UK.
Yeah.
Then the hotel, and I decided just to come.
Where is your hotel nearby?
It's 15 minutes away by car.
Okay.
It's nearby. It's cheap, to be honest.
Yeah. People ask me, why don't you arrange all of these hotel and so it's time taking for me, and I have to employ another person for it.
Yes.
So I have to pay to him. So you will pay more.
Yes.
Because I have to take this from the patient.
No, but
so
nowadays it's really easy to arrange these things. I
Yes.
mean, if you use bookings, the website,
yeah.
you can do everything.
See many hotels, and Istanbul is a touristy place.
Yes,
and
exactly. It's
you
very
have
easy.
tens of options,
Exactly.
hundreds of options
Exactly.
in every cost. So, for example, there is a hotel nearby. I recommend them. I have no gain from them,
Yeah, no.
but they are very costly. This is a doctor's building, and we send many patients to them. They increase the price from the 80 euros, now it may be 140. We are saying, please don't do it. And we will not choose you because, okay, you are in 20 steps to us, but there are many hotels nearby. So they are full, overbooked, and they are doing like this. So we change the hotel.
Yeah,
or
the business is business after all.
So you find the hotel and
Yes.
transfer from airport. They all can be arranged. I am sometimes asking the firms, what's the cost? They say really double or 3 times of a taxi price. So why? There are a lot of taxis. You can find
Yes.
one, and this transfer, hotel, such things are always. There are some commissioners
Yes.
which will want a lot of money.
Yes,
They are
I know.
really crazy. I am sometimes, and some agencies, health tourism.
Yes.
People come to me, hey doctor, what do you want for varicocele surgery? I say my price. They say, oh, okay, this is a good price. And people come from these health tourism services. I hate them. And the price is tripled. I said, whoops, what's that?
Right.
They said,
Okay.
oh, there are 3 commissioners in between.
Right.
It is really, I hate.
Yes.
I don't like it. I try to find the people from myself with the internet and try to, the cost is, you choose the highest live hospital, which has the highest rate.
Yeah.
Still, it is not too much expensive.
Yeah.
I try to keep it really bearable, really tolerable. So, of course, there are hotel costs, travel costs, many things. So I have to think of them, and what's the percentage of operation cost compared to your total payment for this
Yeah.
travel?
Sorry, say that again.
So the cost of the surgery,
Yes.
and its ratio, its percentage to total, your total.
Total. I would say, I don't know, maybe
Less than half, maybe.
around
Think
half.
about-
Let's say half. Half
So
of the
thinking
cost.
about the plane and hotel and such living here, maybe
Yeah,
half. Yeah.
half. Yeah, I would say the half. Yeah.
Okay.
Maybe half. Yeah.
Okay, so it's not ethical and logical to say the prices here, but I have a video
Yes.
explaining all of these.
Yeah.
Really, it's forbidden for the with the hospitals, government, such. They don't want us to
Right.
say the price, but I can say there's a video explaining all of this. So yeah, I try to keep it less cost. There is another cheaper option, cheaper hospital. Many people choose it. Really, there's not too much difference. Only the hotel quality.
Can you remind me what was the difference between
Yeah,
them?
nothing.
It was the clips, I think, no?
Clips is okay. Clips are very expensive. They are in this Live hospital.
Right.
So much of the difference in the cost maybe because of that. So I like to use these clips. Sometimes people have concern, will they be permanently inside? They are produced for this. They are very small in size and they are just covered with the body tissues and you will never feel them. And I don't put them into the scrotal part,
Yes.
around the testicle. I only put them in the inguinal part. Never one of my patients had a problem with that.
Right.
And it quickens my operation. It fastens the operation because with ligation takes sometimes 1 minute, 2 minutes,
Right.
but putting a clip 2 seconds. So I can
And
put easily.
It's more secure
fast.
after that, yeah.
Yeah, it's security if you ligate nicely, no problem. But it quickens the procedure.
Right.
So it's good. So and the quality of the other hospital, it's in another part of the city, a little far away. So this part is cheaper, and the hospital, your hospital is fancy, like a fancy hotel.
Yeah, it
And
was
the
really
other
nice.
is a little more boutique hotel. So, but all of my patients are happy.
Yeah.
I would change it, or I would never do. There's only $500 difference.
Right.
So I would not do that if there is too much concern, too much problem
Yeah.
about this. So I am still doing. It's nice. So how many days passed after your procedure now?
So it was on Tuesday, today is Friday.
Friday. So
So-
you come to Turkey at Sunday,
Monday.
Monday morning.
Yeah.
And okay, you come Monday. Normally I do the preparations on Monday, but in your case we did the preparations on Tuesday morning,
Tuesday morning.
and Tuesday afternoon you had the procedure.
Yes.
This is a little, I don't like it because I couldn't see you before the operation till I go to hospital.
Yeah. No.
So you during the preparations, if you go late to hospital, the preparations will not, it will be too late.
Yeah.
So you have to be there early. So we didn't see you at the morning.
Yes.
If you come one day before, it is more easy. We will discuss.
We'll have enough time for everything, yeah.
Yeah, but we discussed with you on online consultation, so that's why you were. It was easy to make a decision. And in the hospital, I have another Doppler device. I look and see your veins nicely. Okay, so and today after the operation, Wednesday, Thursday, this is third day, and you come here walking with your bags on your back.
Yeah.
How do you feel?
No, I'm okay. I'm not even using the painkillers.
Yeah.
You gave me in the hospital, so I'm feeling
You are
good.
using your antibiotic,
Yeah.
and we will give you a medication to increase the sperm quality. You are not married, we are not hurrying, but still we want to be back to normal position as
Right.
quick as possible.
Yeah.
So after 1 month you will start these medications, you will use them for 3 months and
Okay.
make a sperm count. So it will take 4 months from now to make the new sperm count. Sometimes I say let's do it in 6 months in singles, not in married people.
Yes. Okay.
So we will follow up. People come to me from all over the world. They ask how we will follow up. Actually, we will follow up from WhatsApp, internet, and if we have some suspicion, I will ask you to make a control there, if possible, to come here. It's very rare in this operation. We need such things, but we will see if needed. We will be in communication.
Yeah. No problem.
So, do you recommend people to do this surgery here?
Yeah, definitely, definitely.
Thank you.
I recommend to everyone to come here and visit you. If
When I do
people
this
have any
Doppler
problems.
today, it's empty. Everything is finished. There is
Yeah.
no vein that
Yeah.
we will wait for disappearing. So it's over. It's finished. I am very happy. Thank you for coming.
Thank you very much, doctor.
Thank you. Thank you for this video too.